Over the next 20 years, our world will change in many ways. Some changes we can still control, while others cannot be avoided. Our population is growing and getting older. We're becoming more urbanized, with resources becoming more and more scarce. How could potential game-changing technologies impact access to healthcare over the next 20 years? In this video, we aim to answer that question by examining two scenarios: quarantine and group therapy. In the quarantine scenario, there's a short-term focus on national interests, creating a fractured global order and rising inequality. In the group therapy scenario, governments focus on coordination and collaboration, tackling world problems together for the greater benefit of all. Starting with the quarantine scenario, the continued economic downturn and record debt puts huge pressure on governments who focus on national interests. EU countries are forced to cut public spending on healthcare and R&D. Coordination within the EU breaks down, and standards of universal care decline for those who can't pay. In the US, dissent rises over Obama's healthcare reforms, delaying its implementation and increasing the need for private healthcare. US government R&D spending is refocused on cost-effective technologies such as artificial intelligence and paper diagnostics. India's rapid growth continues. However, due to ongoing poverty, resource shortages and poor infrastructure, a large part of the population still doesn't have access to good healthcare. Innovative uses of cloud computing and wireless communication provides low-cost access to a skeleton healthcare. Nevertheless, the poor continue to die from preventable diseases. The Chinese government takes control of their largely private healthcare system, investing heavily in infrastructure and R&D, and develop their own pharmaceutical industry focusing on drug availability and national health problems. With reduced US aid, Africa, with its rich resources, looks to China for investment. Yet despite capital influx, continued corruption means that African infrastructure doesn't receive the investment required, and key technologies fail to integrate into society. Lack of medicines and physicians result in an increase in the number of deaths from preventable diseases. The US acts to protect their industry and imposes high import tariffs on Chinese drugs, resulting in increased tensions between the countries who by 2015 lead the world in R&D. Yet with separate systems and duplication of effort, R&D advancements are slower and more costly, and some technologies with great potential, such as personalised medicines, struggle to be implemented because costs remain high. Chinese government efforts to increase healthcare access prove ineffective. By 2020, their ageing population forces further increases in government spending, dipping into huge cash reserves, and when recession hits in 2020, China fails to recover quickly. India's growth proves more sustainable, and with their economy better equipped to face the 2020 crisis, become leaders in R&D as we move towards 2030. While a growing middle class emerges in India, large disparities still remain. The gap between rich and poor continues to increase, and deaths from preventable diseases grow. R&D remains uncoordinated, so progress is slow. With the significant rise in privatization of healthcare systems in the US, EU and Russia, and continued reliance on private healthcare in India and China, the world divides between those who can afford access to healthcare and those who cannot. On average, access to healthcare falls globally. In the group therapy scenario, after a deeper economic downturn, leaders respond to global political pressure through international cooperation. A revaluation of the renminbi in an upward direction by China acts as an important catalyst for the gradual reduction of global debt levels, and global economies stabilise before seeing robust economic growth. The public demands other improvements from government, like better healthcare, which can only be met through increased global cooperation. Nations take a new approach to pharmaceutical intellectual property rights. Following the lead of the software industry, well-funded government health bodies, with the assistance of niche pharma companies, begin to develop open-source medicines and pharmaceuticals. This has significant implications for the treatment of preventable diseases in developing countries. An increasing level of trust between nations results in more rapid transfer of knowledge and significantly reduces time to market for a wide range of technologies. A steady stream of foreign direct investment in developing countries drives urbanization and, at the same time, results in increased literacy rates and skill levels. This in turn results in an increasing number of people having access to healthcare professionals, hospitals, and other basic forms of healthcare. Rural areas benefit significantly from rapid developments in technology. The development of energy storage devices, paper diagnostics, and internet availability leads to increased healthcare in remote areas through mobile medical units and virtual clinics. In response to the 2020 recessions, there are moves to introduce regional currencies among ASEAN and Mercosur nations, providing greater balance to the global monetary and financial systems. Trade barriers are reduced and a coordinated investment program in resource, infrastructure and healthcare projects in Africa takes place as part of a major effort to reduce the large social and economic imbalances. By 2025, therapeutic robots are increasingly used in surgery. 3D technologies, screenless computing and machine translation software are becoming valuable tools in the training of healthcare professionals, particularly in remote locations. Further advancement in nanotechnology, nanomaterials and personal medicine leads to a focus on prevention of diseases rather than cures. Acutely aware of the aging population, nations invest heavily in research and infrastructure for the aged from an early stage. China pours considerable resources into this area in coordination with OECD countries, with major benefits being seen through biogeron technology in the mid-2020s. As 2030 approaches, with greater economic equality, improved skill levels, particularly in Africa and rural India, and availability of technologies that improve healthcare delivery and lower costs, access to healthcare is significantly improved in the majority of countries. The two scenarios in this video describe two very different worlds with two very different outcomes. One world where access to healthcare is only for those who can afford it. Another, a world with access for all. One world with deaths from preventable diseases. Another where countries work together to tackle this developing world problem. One world where duplicated effort and self-interest slows technological innovation and R&D advancements reduce. Another of collaboration, fast development and more advanced medical technologies. One world of opportunities for the few, another with opportunities for the many. One a quarantine world, another a world of group therapy.